puzzling and concerning to us. But 31% decline in the border areas. Bellwood Park, not much change there. Slight increase in Union Square. I'm not going to dwell on these right now. These are regression model estimates. And here you see this relates to a 19% increase in non-fatal shootings in the Gallery Park associated with the program, a 20% reduction in Bellwood Park, and a 32% increase in Union Square. Again, I now sort of regret even putting Union Square in this model because of all the problems with A, with implementation, and B, what one assumes about a start date. Other noteworthy findings, if you combine the two outcomes, McAllen Park does have a larger reduction than in other comparison posts. The Union Square effects, as I mentioned, are very fragile. The East Side Safe Streets intervention area and the border post experienced fewer homicides and non-fatal shootings of victims under age 30. That's the group they were focusing on. And when you look at this group of individuals under age 30 who were killed in homicides, the other thing we found of interest was that more drug arrest was associated with more homicides. Now this was after even controlling for sort of baseline levels of violence, which actually I've always sort of worried that in medical terms we would call this a side effect, iatrogenic sort of effect of aggressive drug policing. I used to have a friend in the police department who headed the violent crimes task force, and whenever there would be spikes and shootings in different parts of Baltimore, I would say, what's that all about? What's going on? Invariably, the response was, well, we just took down a drug operation over in that area, and then they're fighting for all the, leftovers. And I would say, well, why would you do that? Why would you try to reduce gun violence? But they don't think like a public health person. Alternatively, more weapon arrest was associated with reductions in youth homicides. Okay, there are limitations. There are a lot of determinants that we can't measure. There were other initiatives being launched, principally policing interventions that I alluded to before, that I think probably had something to do with some of the downturns in violence. And the police have not been so great about getting me the specific enough information so that I can incorporate that into my models, but they're promising me that they will get that to me. We also were hoping to look more at the age of offenders, but what we found is lots and lots of missing data, and we just couldn't really do much with it. So we looked at age of victims. Not sure why non-fatal shootings didn't drop as much as McElroy Park, but I talked to Leon, Farouk, and others about this, as well as Gary Slutkin. And I was sort of disabused of my notion that I said before that maybe they're not, these two phenomena of non-fatals and homicides are, maybe they are very distinctly different kind of phenomenon. And if the intervention is directed most at the most lethal individuals, maybe you have a bigger effect on that outcome than with non-fatals. Of course, Chicago did have positive effects on non-fatals. One, I think, very important differences between those two cities is Baltimore has lots more guns than Chicago. I know there are guns in Chicago, but actually there's good research showing that they're not as prevalent as you might imagine, whereas in Baltimore, we have not done a very good job at all of managing guns and keeping guns away from dangerous people. All right. This is Leon again leading a community response. You know, I'm a social scientist, all right, and I'm supposed to connect all the dots to theories, and in my world in public health, we say evidence-based strategies, right, okay? That's great, all that theory's good, evidence-based is good, but something like this, and maybe a lot of strategies that maybe you're involved in with violence prevention, there's a real important human element, and not anybody can pull it off. You have to have incredible integrity, courage, insight, people skills, and not everybody can do that. And I hope to God that there are others in East Baltimore who will step up to the plate and fill his big shoes. I wish we could put this everywhere in a city that needed it. We can't. We don't have the resources. But it leaves me sort of wondering, could you do this with fewer resources? I really don't know. Gary Sutkin, I think, is very doubtful that that's possible, and maybe that's true. But I'm curious whether you could actually start some sort of volunteer effort that would look something like this, that you could give them some added supports to do this. Okay. I want to talk about another way to address gun violence from a public health perspective. I'm going to race through some of this. I apologize, because I knew you were probably more interested in what you all hopefully will be launching soon. But the other side of my life and work has to do with trying to keep guns out of dangerous context and dangerous situations and people. So basically what we do is we apply principles of microeconomics to try to increase the risk and cost associated with illegal gun possession and illegal supplying of guns to criminals. So if you're going to increase the odds illegal gun use are going to be punished, one approach is special policing units that go out into the hotspots for shootings and make it riskier to be having a gun, illegally possessing a gun. So that has been tried in a number of situations, a number of cities. Another slight modification on this that focuses a little bit more on individuals that they might think are most likely to be, you know, a shooter, to increase the likelihood that they're going to get caught with a gun. So one is sort of focused more on place and time, the other is focused more on individuals, with a similar concept of you're trying to make it riskier for them to go around possessing a gun. So the sort of place-based focus began in Kansas City, a landmark study by Larry Sherman, and found that in the area where they did this, they reduced shootings by 49%, with no spillover in other areas and no changes in the comparison area. There have been other cities that have tried this as well. I'm not going to go through every single one of them. The most recent, however, was Pittsburgh, a part of Pittsburgh that tried this. They reduced gunshot wounds by 71% with this strategy. And what was so compelling about this being a cause and effect situation was they lost the federal funds to do this. And beyond me why they chose not to continue it anyway, but they did. They discontinued the program. The rate of shootings went precisely back to where it had been before they did this. Another strategy that's more person-focused is sort of the David Kennedy Boston ceasefire model. We're not going to get into all the details of that because, again, I don't have that much time. But there's a call-in process. There's the deterrence face in front of you, but there's also individuals from the community and service organizations ready to help the high-risk individuals make better choices that will get them into less risky lifestyles. One component of this that particularly is gun-focused is what they called Operation Nightlight, where the individuals on parole and probation Reports couldn't be in possession of a gun. It's a little easier